Okay, let's assume that you have high blood pressure. What do? Well, you go to the doctor and he gives you a pill to lower your blood pressure. You then take said pill and your blood pressure is lowered. What happened? Well, the drug inside the pill obviously had some kind of effect on your body that lowered the blood pressure. Well, the drug inside the pill obviously does something inside your body so that the blood pressure is lowered to a healthier range, so you don't die within 5 to 10 years, which is great. However, your body also does something to the drug inside the pill. How can you prove that? Well, the next day you have to take another pill, and then the day after that you again have to take another pill. And when you take ibuprofen to help with your headache or something like that, it does not work immediately. It takes a while in order to really be active inside your body. This is unlike with morphine, where you would inject it and then within a few seconds you don't really feel the pain anymore. So why is this difference? Let's first look at the breakdown of medicine. Your body doesn't see medicine as something good. It sees it as some kind of strange substance that's all of a sudden inside of you and that's not used to. So it's probably dangerous, so we probably should break it down and just get rid of it. This can either be done through the kidneys, where the blood is filtered and all kinds of toxins and stuff that your body thinks you may have too much of just gets filtered out and then excreted through the urine. Or it can be filtered out through the liver, which will take the molecules and then chemically convert them into something that's broken down so it's no longer active and no longer potentially dangerous. Because of course, everything in a high dose is toxic to you. It should be noted though that in both of these cases, the medicine is brought to the organs through the bloodstream. So let's assume that hypothetically you just inject someone with some kind of medicine into the patient's blood. It doesn't really matter what it is, just that you did it. And then you take the patient and you put a tiny machine, some kind of probe inside of, let's say, the aorta. It's nice and easy next to the heart. And that will measure the amount of medicine inside the blood. You'll see that at first the concentration is very high, but as time progresses it comes past the liver and past the kidneys. So the concentration will continue to drop until eventually it's pretty much non-existent. So it will be, like this. So you can graph it kind of like this, as a hyperbole. So basically it becomes an exponential decrease. And usually more medicine in the blood means that there is more effect, which obviously makes sense. And as the concentration gets lower, at a certain point, it will get below a threshold where it might just not be effective anymore. So then you would want to increase it by maybe giving another dose and then letting it go back again. Goes up, goes down, and it just continues like that. But why does it take a while for a pill to work versus an injection? Well, as we said before, an injection just immediately brings all of the drug into your bloodstream all at once. But a pill has to go through the digestive system first, through the stomach, and then get absorbed into the intestines. And once inside the intestines, it's not like everything just gets absorbed all at once. It takes a while because it's all distributed throughout the inside of you. This absorption into the intestines is pretty much like eating a bag of sugar with a teaspoon versus dumping it into your mouth all at once. It takes a while for everything to be absorbed. So that process can be seen as an increase until the maximum point where everything is absorbed, and then it goes down, just like the injection. So basically from this point on, it's the same, but here, it first needs to be absorbed, which shows this increase. And of course, it is measured from the point that it's inside the intestines themselves and not first through the entire digestive tract. Otherwise, it would end like here. Well, start like here and then go down. But we measure it like this because you don't really know how long it takes for everything to be absorbed, because there's too many factors for it. So, yeah. Now, these lines are all very curvy, and as humans we don't really like curvy things. We like straight lines because it's easier to understand, easier to calculate with. So if instead we put on a log scale where here you have 10 instead of 100, 100 instead of 500, and 1000 still here, then you get a straight line going down. And this again is a lot easier to calculate with. However, then maybe you try something in the lab, and then all of a sudden you get a result that looks kind of like this. What happened? Why did it just go like this? Because you really find this in the lab. And it's not because of an error or anything. So how can you explain this? Well, in order to explain it, you need to make a few assumptions. The first assumption is that as soon as medicine is inside the blood, it's evenly distributed throughout the blood in its entirety. Normally, if you would inject medicine, it may take half a minute, maybe even longer for everything to be equally distributed throughout the blood. But we just assume that it immediately is because, again, it makes calculations a lot easier. Next, medicine can only really be found inside the blood. It's very difficult to measure the amount of drug that someone has in their spinal fluid or in their urine every hour. And it's also not very ethical to do that. But medicine is not always in the blood. Some medicine affects the brain. Some drugs, they have this kind of second compartment where the drug can have its effects. Or it may just go somewhere else, for example, into the fat and just stay inside your fat tissue and not really do anything there. Think of it like a glass that's half filled with water and half with oil. The medicine can be detected in the water, but it performs its function in the oil. So the drug, it prefers to be in the oil roughly 4 out of 5 times. So the concentration in the oil is 5 times higher than in the water, but you can only detect it in the water. So if you measure the concentration as being 5 milligrams per liter inside the water, then there's 5 times as much because only 1/5 is in the water. So then there's 25 milligrams of the medicine inside the glass and 80% is inside the oil. But the water gets cleared of drug at a rate, so let's say 50% per hour, just make it easy. So then after an hour, there's only 2.5 milligrams in the water, but hypothetically there's still 20 in the oil. But the molecules move from the oil to the water. So then concentrations again will be adjusted to have this 4:1 ratio between oil and water. And the total amount in the oil is lower and the total amount in the body is also lower. Now let's say that instead of water you have blood and instead of oil you have basically every other tissue inside of a patient. So the fat tissue, the brain tissue, the muscles. This is of course just an example. A drug may be very soluble in water and then want to be in the blood 80% of the time, or it may just really like being inside fatty tissues and just stay there 99.999% of the time. But it differs based on the chemical properties of the molecules of the medicine. But the same is true when you add medicine. When it gets into blood, it will immediately go to the other tissues until those tissues and the blood have reached the perfect chemical balance, so to speak. Because of this, the concentration first just drops very quickly as it tries to reach this equilibrium, and then once there, it staggers, and the drug at all times still moves between the blood and all the other tissues, but here it has reached this equilibrium, and meanwhile here, it will mainly move from the blood to everything else. So the concentration gets lower, and during the entire process, of course, it also gets excreted by the kidneys and metabolized by the liver, so that also inactivates it. But over here, you mainly just have that process of the body getting rid of the drug. So that line would kind of move like this, and then this is all of the distributing. And because of this breakdown of the medicine, at some point it just is too low in order to really be effective. And then you basically need to take a new pill or something like that in order to get concentration back up to a point where it still functions. But of course you have to do this at the right time, because if you take it too early, if you take, for example, 2 pills at once rather than 1 pill 2 times per day, then the concentration might just get too high, and then you may just get toxic effects, and that will even make you less happy. And of course, there is a lot of variance between the patients. One patient may have dog shit kidneys, so they excrete medicine a lot slower, or some may excrete it a lot faster. Some people may just have an amazing liver that will break down anything you throw at it, and they will need a lot of medicine in order to be cured very effectively. And also, some medicine needs to be applied using creams, which don't go to the blood at all, so you cannot measure that using the previously described method. And in order to make these calculations, you have this program called NonMem. Now, NonMem was developed in the 1970s, and it's kind of an enigma. You see, both the creators, they are dead, and there are a lot of errors that you can get in the software, and nobody knows what they mean except for those two people. And as someone who mainly uses R, NonMem is even worse. And in pharmacokinetics, you basically need to use it or nobody in the field takes you seriously. And I get it, but also they're gatekeeping by forcing you to use NonMem, which is hilarious. And why is there no new software that can do the same thing properly? Well, because the amount of people that are in this field is so slim that you can probably calculate it on two hands, just about. And developing a new program will not be economically viable at all. You'll lose money on it. So yeah, that's a short intro into the field of pharmacokinetics. So basically what your body does to the medicine, how it can break it down and how you can visualize it and kind of calculate with it, even though we didn't do that, but whatever, calculations, they scared doctors away. Now there's of course a lot more to it than just this, but this was a short intro and I hope it satisfied you.